enjoy the best offers on voice and data.
To buy a bundle for friends and family, dial *149*.
We insist on to manage and help the vulnerable people that was talked about. Even when others, it is just great exchange of land. Why would you give people money for food or anything?
I understand that people actually who can't survive without that support. But it also tells us that people who have survived without that support. Now, for me, I think the issue of giving people hard stuff, when you balance, it comes out well than when you are giving people money. There was the issue of quality food that was given, that can be addressed. I suspect some of it was actually political. When you buy posho and beans,
it is easier to steal 20,000.
Yes.
For posho.
Yes. Now the other thing is that, when you talk of 140,000 to 120,000 in terms of food, if you bought someone matoke, or you bought them beans, or you bought them rice, or you bought them posho, I think it's even going to be more in terms of size than giving someone does your chairman know you?
I actually posted that on my Facebook page, and I also tweeted it on my I posted it on my Twitter handle to just ask a question. Do you know your also chairperson? And does he or she know what you do for a living? Because it's one thing to know that my chairperson is Christopher Chirumena in this case. My chairperson is called Christopher Chirumena. But does Christopher Chirumena know what I do? Because even if you cascade it down to the villages and you told the people, let the chairpersons write the people who are vulnerable in their localities, in their villages. Would Christopher Chirumena know what I actually do if so now Christopher Chirumena may know what I do because he says exactly. He knows me and I know him. But would Christopher Chirumena be able to know what Mtuta does because he knows there is a person in the village called Mtuta. But when you leave in the morning, he doesn't know they go to start, he doesn't know they go to an arcade. We want to look at all the lists and have names from Mbarara. And now we say, how do you tell the name from Mbarara? Well, because these are in a village called Lunguja somewhere. Why do you think that when you look at a name like Natumanya, Kasinje, what, these are all names from Mbarara? Now, even if they are from Mbarara, when did you now realize that you don't want these so many names from Mbarara in your village? Because they are with you every day. Now, if all these names that you're contesting now came to your shop to buy, on a regular day, on a normal day, would you say, I don't want to but you see now that's where the challenge is. We've demanded and pushed, yes, but what lesson are we learning? Because we thought maybe our local leaders, their politicians, know more about us and know what concerns us. But it's not the case.
And the things you are looking to, they have a radio, they have a TV, they have this, and how many of them? You can tell that these people are in this house, but this is what they need. But at the same time, maybe that information has not been digested and shared across the board. But of course, we also appreciate that no one was prepared for COVID. There could have been better ways of preparing, but there was no way.
Okay, we've also been told that His Excellency
When do we start?
To them. We have Vicky Tara.
Countrymen and countrywomen, greetings. Today marks the 42nd day since I instituted the lockdown on the 18th of June, 2021. The lockdown was guided by rapidly increasing daily cases, increasing positivity rate, high admission rates in hospitals for severe and critically ill patients, and increasing number of deaths. Therefore, I had to intervene to protect the health system by people, you find that only 8 have a fall in the daily admission of the severe and critically ill patients from 204 at the peak, less than 50 per day to today. The hospital admissions was also another big problem. People were sick who went to hospital. There were too many. That time, 204 would be taking admission in one day. But today, 50 are the ones who want to go into the hospital, who are critically ill. There has also been a reduction in daily death. However, the drop in the daily number of deaths remains slow due to late presentation to the hospitals. This is the biggest problem. People, when this crisis started, on the 18th of March, I was on this TV, and I really told you everything the doctors had told me. And one of them was, as soon as you hear symptoms like flu, like saying, even when you don't feel well, you feel like fever, you think it may be malaria, go and check corona. That's what we told you. But some people, even here in the State House, we have had to take disciplinary action against staff here. They hide. Somebody is having senior, is hiding, denying. They must be able to insist. Why are you? And when they check them a number of times, they have corona. Now, that's where the problem is. Because this disease apparently is very dangerous. It attacks the lungs. And you know the lungs are the only ventilation the body has. Now, when you delay, the lungs get damaged seriously. I hear even the kidneys. That's what I hear. So and 2,690 deaths. This 2,690 deaths, this is recent. Because by April, I think we had lost only 200 and something people. By April, after the whole year. But because false prophets, Banabi Abolimba, they come and say, what the government is doing is nonsense. You go. They are stopping you because they don't want you to have rallies. Because you will have huge rallies if they don't stop you. Who can have bigger rallies than NRM? I have never seen any myself. Normally when we have rallies at Kororo, we have 1 million people. So when we were saying please don't meet, it was not that we didn't want opposition to have rallies. It was that we didn't want our people to die. So you can imagine now, because by April, there were no patients in the hospitals. I think March there. I know this because there is a drug we are trying, one of our indigenous drugs which we are trying. We needed patients. And there were no patients. In March, in April, I would ring Museveni. How far have you gone? So we don't have patients. wanted 124 patients to try our drug in them. We didn't get these patients. But when I was checking around March, they were telling me we have only got 21. Because people were not getting sick. Very few people were getting sick. But because of the mistake of the false prophets, Barnaby Abulimba, coming to May, there was an explosion. So that's how we lost this all these more than 2,000 are because of the mistakes of the false prophets. Barnaby Abulimba. Otherwise, by my March, I think the people were only like 200 and something, 60 something. Currently, there are 626 patients admitted in various hospitals. A total of 597 are in public health facilities and 29 in private health facilities. Because now we have got about 4,000 beds. We have now got 4,000 corona beds. Of the beds of the capacity we have now. Only 1/4. Chimuchako now. But by the time we declared lockdown, all these beds were full. All these 4,000 beds were full, were overflowing. But now we're here, only 1/4 are used now. Three quarters are just idle. So it shows you that and because the hospitals were full, that's how people went to private hospitals. And the private people were overcharging them. It all started with the false prophets. So now the people who are in the private hospitals are only 29. 626 are all in the 597 are all in the government hospitals. Of all the confirmed cases, 53,000, representing 56% of all Ugandans that have ever got corona, have happened in this second wave from the month of April 2021 to today. Down there, you will see the graph of the first wave and the second wave. But take a recall, put that graph there. Now you see how the first one climbed up around December and then came down and then was very low. You can see between the two hills, that flat ground, very, very few cases. Then it went up. Now it has come down dramatically. now coming to the corona, put that map. You can see the corona there now. The blue ones are the clean, the blue districts are the clean districts. The ones without corona. The white ones are the ones with the 1 to 20. Then the dark, the light brown, that is 2150. The red, 5100. The purple more than 200. So you can see the purple are the purple, that must be our dear Kampala. And then the other one on the border is Trakai, Uchotera. And then the other one up there, is it Amuru or something? Oh yeah, maybe Gulu. And then the one near the border, would that be Tororo? So the 200 per day. Only Kampala was still high. 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 Now, some of these figures are for Kampala. June up to 13th. Then up to June 14th and 20th, they were 8,000. 8,000. Are these for Kampala only or for all? These are for all. Then 6,033 in June. Then 28th June, 4th July, 5,000 and 120. Then 5 to 11 July, 3,640. And now 1,885 in the whole country. The average positivity rate has been coming down, as I said, from 22, from 18 out of every 100 to now 8 out of every 100. And the average admissions are also going down. In June it was 149 per day. people who are coming to the hospital being admitted. It is now 47. The previous and the current lockdown are part of the preventive health interventions to contain the outbreak in order to protect lives and reduce death. This is in addition to the government's strategy of mass vaccination. The government is using a multi-pronged approach to secure adequate vaccines for the target population of 22 million. Those are people who are 18 years and above. Scientists have informed me that children above 18 years can also be vaccinated using the Pfizer vaccine. I've directed the Ministry of Health to include this age group in their estimates and plan holistically. The following options are being used to access vaccines from the global market. Number one, purchase of vaccines through the COVAX facility. COVAX is like a shared arrangement by globally. Purchase of vaccines through the African Union. Purchase of vaccines from manufacturers. Donations through the COVAX facility. An order of 2 million doses of the Johnson & Johnson vaccines have been made with the African Union, and a down payment of $3 million has been effected, has been implemented. Delivery will begin in August 2021, which is a few days from now. Because today is 29th, 30th. So August is the day after tomorrow. I've been informed that tonight, 30th July 2021, we are receiving donations of 286,000 doses of AstraZeneca vaccine from Norway and 300,000 doses of Sinovac vaccine from China. I would like to thank both the governments of Norway and the People's Republic of China for the United Kingdom. To the population countrywide. 903,000 people have received the first dose, while 233,000 have received the second dose. During this second wave, I was informed of the challenge faced by the COVID-19 treatment facilities due to inadequate medical oxygen. But before I Other countries are already in the fourth wave. So we are not talking of second wave because we were careful. We had succeeded. And we have avoided the second wave completely. You saw that graph, it was flat from December last year. Very, very few cases. So if people had listened, we would not have gone for the second wave. Other countries are now already in wave number 4. For us, because of the false prophets, in spite of all our efforts, we are now in wave 2. So please, let's work to avoid the third wave now. On the issue of oxygen, the government is enhancing the existing oxygen production and supply at the national and regional referral hospitals in Uganda, cater for both COVID-19 cases and other essential medical services. The procurement of gaseous oxygen plants, pressure swing and absorption is ongoing, and this will be installed in all the 15 regional referral hospitals and Bombo Military Hospital. In addition, a similar oxygen plant with a bigger capacity will be installed at Mulago Hospital. Furthermore, 3 cryogenic liquid oxygen plants will be procured and installed strategically in 3 regions of the country to complement the gaseous oxygen production. The Minister of Finance has already provided funding for this. This will solve the current oxygen crisis. When I was discussing with our team, we were targeting oxygen capacity of 24,000 cylinders per day. Was it 24,000 or 18,000? So these machines, the 16 in the referral hospitals and the 3 cryogenic, the one cryogenic is the one of liquid oxygen, which will be in 3 sites, each one producing what? 5,000? Each one.